He's taking on the big shots and working hard to get you answers. 8 on your side, Steve Andrews investigates.
He stopped breathing in a dentist chair and then died. Investigators claim the dentist is at fault and should lose her license. Is Florida's Department of Health even listening? So what is going on with the Department of Health?
Its own investigators claim a Newport Richey dentist made one mistake after another while treating Tommy Myers. Tommy's heart stopped and then he died. 8 on your side, senior investigative reporter Steve Andrews is joining us now with a follow-up to his report. And this is something that even doctors who were reviewing the case said that her license needs to be revoked, and yet it hasn't been.
Now, for whatever reason, the Department of Health is seemingly ignoring its own experts. Now, this all began back in 2014 when Tommy's dad brought him in for a dental appointment. Tommy Myers stopped breathing while undergoing a procedure at Grand Dentistry in Newport Richey. When he arrived at Morton Plant North Bay, his heart wasn't beating.
I looked at Tommy and I said, he has staph lacerations.
For 2 days, Tommy remained on life support until doctors assured Gary and Maureen Myers he wasn't coming back.
Nobody, but nobody, and especially Tommy, should have ever had to die this type of a death.
What happened in that dentist chair? A Florida Department of Health investigator determined Dr. Veronica Thompson made several mistakes. Chief among them, Dr. Thompson administered too much sedation too quickly. It took nearly 2 years, but the Department of Health charged Dr. Thompson also violated Florida law by failing to follow proper emergency protocols by not administering a reversal drug.
They said that she was administering deep sedation without a permit.
In May 2017, Dr. Thompson appeared before the Board of Dentistry. She answered questions and apologized.
We're just all really sorry this happened.
DOH recommended a reprimand, $10,000 fine, and the successful completion of the Laws and Rules exam.
So now all they want to do is send her back to school so she can learn what the emergency protocol is. I think that stinks.
The Board of Dentistry rejected the settlement. It voted to revoke Dr. Thompson's license. A year later, DOH proposed another settlement.
I think it's taken too long. Nobody's really doing what needs to be done.
A probable cause panel wanted no part of a settlement.
I mean, just about every violation that you could find in regards to quality anesthesia and appropriate anesthesia has been violated here.
I thought that this patient was not well taken care of, and the doctor's completely at fault. Completely at fault.
And this is about as bad a case as, I've seen in my tenure on the Board of Dentistry.
The panel recommended license revocation. DOH is seeking yet another settlement.
She neglected my son, and no amount of money, no amount of fines, no amount of school is going to bring him back.
They need to revoke her license.
I think that the state is taking the easy way out.
Now, back in September, probable cause panel member Dr. Carl Melzer told the Department of Health lawyers they need to suck it up and take this case to the Division of Administrative Hearings to revoke Dr. Thompson's license because he said this case is that bad. Here we are 7 months later, and the state is negotiating yet another settlement with Dr. Thomas and her attorneys.
In the meantime, she's still practicing dentistry as well.
Yeah.
So why not follow the Board of Dentistry and the probable cause panel? Why not?
Why not follow the recommendation? That's a question I asked, and the Department of Health has yet to answer. Now, Tommy's patients wonder if the state has placed a lesser value on Tommy's life because he was a patient with Down syndrome. 4.5 years delay, and they're negotiating a settlement here. Makes you wonder.
It does.
Thank you, Steve. If you have a problem you want Steve to investigate, give him a call. That's the 8 on your side helpline number, 1-800-338-0808.